So now when we're talking in terms of functions, and we're still talking a little bit about the functions of the placenta, endocrine gland is the first one that's kind of started as functioning, and it's producing 4 hormones that are necessary to maintain the pregnancy. We talked about some of those hormones when we talked about health assessment and from the endocrine system. The other thing is when we are talking about estrogen, it's important. It's one of those hormones that stimulates uterine growth and uteroplacental blood flow. We also talk about the metabolic functions of the placenta. That includes your respiration, nutrients, excretion, and storage. The other thing that happens within the placenta is your carbohydrates, proteins, calcium, and iron are also stored. We need to store these because we have to meet the demands of the baby. Fetal concentration of glucose is actually lower than mom's concentration of glucose, and this is because the baby's metabolism is super fast. Waste products can cross the placental membrane. If there is interference with circulation to the placenta, we cannot supply to the baby or to the embryo. We talked about that. If there was no amniotic fluid, the baby couldn't float around and they would be compressing on things. The other thing that happens during pregnancy, if a woman lies on her back, she puts pressure on the uterus and because she compresses the vena cava. Then what happens is the blood return to the right atrium actually decreases, so she ends up with supine hypotension. So most moms should be educated not to lay on their back. So when we talk about fetal maturity, there's a word or a term that comes up, and it's called viability. Viability is the baby's or the fetus ability to survive outside of the uterus. With a lot of things that have changed in healthcare, the textbook says that between 22 to 25 weeks gestation, these babies are considered to kind of be on the threshold of viability, that they could be successful and viable and live babies. Now, one thing to remember, we are talking that normal pregnancy is 40 weeks. If we deliver a baby around 22 to 25 weeks, that baby has so many high risk of all kinds of complications, organ complications, vision complications, lung development. So there's a lot of issues that could occur with these babies and for the long haul. So now we're going to move into the picture that you guys are looking at. The picture you are looking at is the fetal circulation system. Cardiovascular is the first organ to actually function. And when we talk about the cardiovascular system, it's important for your blood vessels, and blood cell formation begins about the 3rd week. This supplies the baby or the embryo with oxygen and nutrients. And I'm sorry, I get so stuck on saying the word baby, but we're still talking embryo stage. By the end of the 3rd week, the heart begins to beat, and the cardiovascular system is actually linked to the embryo. During the 4th and 5th week, the heart develops the 4-chambered organ, and by the end of the embryonic stage, which is your 8 weeks, the heart is developmentally complete. So the heart is completely developed by 8 weeks. I'm not going to talk about twins or multiple gestations. There's a little snippet in your textbook that goes over the difference between monozygotic and dizygotic. I'm not going to get too crazy and focus in a lot on twins. We are going to kind of continue on with that. Here it is a single birth, a single pregnancy, a single baby, and that's how we're going to kind of move forward. So you guys can review that. You do not have to really hone in and give a lot of attention and detail to that. The other thing is you guys have a nice table on 6-1. It's a nice review table, I think, when you guys study for boards. It goes over the different stages, weeks, So you have 4 weeks, 8 weeks, 12 weeks, all the way up to 40 weeks. It gives you little snippets of what's going on in each system, what is developing in the GI system, what's developing in the respiratory system, and the measurements. I think that is a good review for boards. I do not want you guys to focus and study and beat yourself up to study this table, because I'm not going to ask you direct questions. That's not really going to be how you're going to be tested on boards anyway. Okay, so it is a nice table for review. Just keep it tucked away for when you guys study for boards. The other nice table, which is a good review table for boards also, is on page 166. This also goes through the different stages, and it kind of gives you the major congenital abnormalities that can happen, and defects at kind of where they start to develop at what stage. So that's a good review for boards also. The last couple of things that we have to talk about is your teratogens, and we have a slide for that. So when we talk about non-genetic factors influencing development, there are different teratogens that could influence growth and development of the embryo and the fetus, and also have effects on the baby after birth. Drugs, chemicals, infection, exposure to radiation. You know, when the girls, when you guys are probably in clinical, and if x-ray comes, they usually have you step out of the room because, you know, they don't know if you're pregnant, if you're not, and that can influence development with babies. Nutrition is another big key. We always think of moms, you know, you'll hear them say, this is my excuse to eat, I'm so hungry and I'm eating for two so I can eat what I want. But we never really see the side, or you don't see it as often, the side where moms are actually malnourished, and this has effects on baby also. So this finishes up our chapter 6, and we will move on to chapter 7.